congestive heart failure with a defibrillator. Despite that, plus all the medications you're taking, you're having to go to the hospital with decompensated heart failure. So your cardiologist recommends that you get an upgrade of your defibrillator. What should be your next step? Welcome back to Montgomery Heart and Wellness, and we have another clinical rounds case for you today. And so, Camille, we have a patient who's 74 years old, has a defibrillator, is on heart failure medication, but despite that, she's still being admitted to the hospital. So what do you have for us? What are some of the details?
Yes, so she came to our clinic for assistance in how to improve her heart function without having to get an upgrade to her defibrillator. She had a left bundle branch block, and so partly for that reason they wanted to upgrade her to the biventricular device.
Yeah, and just for our audience to understand, so this left bundle branch block, it's not a blockage in the arteries, it's an electrical abnormality. And normally the heart sends electrical signals simultaneously to both lower chambers. However, one of the conduction pathways could be abnormal. So that's an electrical block. And so the bundle of the electrical pathway to the left side of the heart was not conducting adequately. So what happens is that she would conduct to the right side of the heart through the normal pathway, and the electrical conduction to the left side of the heart would have to come later through backward pathways. So the problem there is that you get dyssynchrony in terms of the beating of the lower ventricle. So the right side would beat before the left side. So you get something like this instead of a synchronized contraction. So that can have an impact on the electrical circuit, or I should say an impact on the physiology, the cardiac output. You want the chambers, the lower chamber to beat simultaneously. So what we often do is we'll place a lead on the left side as well as one on the right side to synchronize it. So that's what they were recommending to her.
Right. And she really didn't want to go under any surgery again, partly for her just because of her age and, potential complications with that. But she was very dependent on diuretics. So if she missed a dose or didn't take them, she'd get symptoms of pulmonary edema, so it's very shortness of breath, can't breathe, low energy, and she was very fearful of that, so she really wanted to hold on to the diuretics.
Our approach is quite simple. What did we do for her?
It was really just the nutritional approach, so she started with a raw detox, and she actually ended up eating whole food plant-based for 116 days. Most of it was all raw, actually. And her ejection fraction improved significantly during that time.
Now that's quite remarkable. So her EF went from 20% to 50%.
Yeah.
And she was able to get off the diuretic. She was doing much better, had much more energy, and did not require the device upgrade.
Right.
Now, I will say, practicing, in cardiology for 27 years, I'm an electrophysiologist. I've implanted thousands of defibrillators. I implanted recirculation device. In fact, I implanted the recirculation device within about days to weeks when it was released on the market.
Yeah.
And so I've been implanting a lot of these, and I've seen they work remarkably well. So she was someone who had an indication for this, but despite not getting it, she was able to improve her ejection fraction, functional status, reduce medications without the upgraded device, only with optimization with that. Now, that's my first time seeing that in a patient with this particular condition.
Right, yeah, it was really impressive, and, she worked really hard to get to that point, so, I think what helped her was also close follow-ups and nutritional counseling, and having that support system.
So nutrition is very powerful. So I think what was happening at the cellular level, she got improvement to overcome the electrical abnormalities that were plaguing her heart. Again, I hope you got a lot of this presentation. If you have any comments or questions, leave them in the comments section, and we look forward to seeing you in the next video. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.